somebody else has said, I usually inject the fat around my waist, but it's getting itchy. Okay, so these are a weekly injection. Saxenda was a daily. These ones are weekly injections. So you are injecting yourself. This medication comes in an extremely non-daunting pre-injection pen. You've got this pen where the medication is in, and you use a fresh needle every time you inject yourself. These needles are tiny. They're really thin. They are maybe, the width of a fine piece of cotton. So they're really small needles. And so if anything, you might feel a tiny scratch as it goes through your skin, but it should certainly not be painful. And as the drug goes in again, it's not a stinging or a burning feeling you should be feeling. Sometimes people catch a little blood vessel in the skin when they inject, and that can sting a little bit, but it certainly isn't, highly painful. So this question about your weight, so waist, the fat of any waist. So where you inject, we generally suggest you inject an area where you can pinch a good inch. You want it to be going into the subcutaneous layer, so the fat underneath the skin. So you want to be able to grab an area where you've got a bit of fat under the skin to inject it. So the waist, the thigh, under the arm, there are lots of places where you can inject and pinch that inch to inject. So there's a couple of things about itchiness of the skin. So number one is please make sure you're using a clean needle each time. You don't want to be injecting with a dirty needle. So use a fresh one each time. You should always be supplying, whoever's giving you this medication should be supplying you with a brand new fresh needle each time. Make sure the skin is clean, and also alternate where you inject. Don't inject in the same spot each time. Try and pick a different place again, so you don't irritate the skin, because obviously you are creating a little injury in the skin when you're injecting it. So again, you want to make sure that you vary the site that you inject each time. Now, some people can have, rarely people can get a reaction at the site of injection, and that very much depends on what that's like. If it's just a bit itchy and a bit red after you inject, and that goes away and progresses no further, then usually that's absolutely fine. Sometimes you can switch drug and see if that makes it any different. If you get a particularly nasty, response at the site, really red, uncomfortable, or there's a risk it's got a bit infected, then it's absolutely worth speaking to a doctor. Obviously, if you're a swimming clinic patient, whether you're an appointment or an online, you can absolutely speak to a member of our team about it, and there can be ways to manage it. But yeah, I would say just making sure you're varying the site, keeping the skin clean. You should really not have too much issue. Obviously, when you create injury, a chemical called histamine gets released into the system. It's part of our immune system, and histamines will make things itch. So sometimes some people simply use an antihistamine and it helps, but again, I won't make that broad statement. I'd like to review you before I'd say it, but there are things that can be done. It shouldn't be a reason to not take the medication.